But first, I want to introduce you to Dr. Nadine Burke Harris, founder and CEO of the Center for Youth Wellness in San Francisco. Known nationally and well beyond pediatric medicine, she is altering the way society responds to kids exposed to significant trauma and toxic stress. We are fortunate to have her with us here today to talk about the intersection of early learning and medicine in addressing ACEs. And I just want to say, having spent a little time with her now, I am already the parliamentarian of the Washington State chapter of the Nadine Burke Harris fan club. I don't want to fight for one of those more popular positions. I'm happy with that. So please join me in welcoming Dr. Nadine Burke Harris.
Thank you so much, Sam. I want to start by saying that I am invited to speak actually quite a bit all over the country. And because of my time and because my husband and I have 3 kids, I'm really, really selective about where I go to speak. And part of my criteria that I and my team use to decide is really folks who are doing incredible work already on the ground. So that my time can be catalytic, but B, so that I can learn from the folks who are doing the most amazing work and then steal all the good stuff and share it with our team back in San Francisco. But I'm really grateful to be here to have the opportunity to talk with you all today about something that I have come to understand as the single greatest public health crisis that is facing our nation today. And that is the issue of adverse childhood experiences and toxic stress. And I know many of you are really familiar with it, and some folks are less familiar, so I will just do a super brief recap, which is that adverse childhood experiences, the term, comes out of a study that was done by the Centers for Disease Control and Prevention and Kaiser Permanente. And this was a study that was published in 1998, where they looked at 10 criteria of what they called adverse childhood experiences. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. And they did the study among a patient population in Kaiser Permanente, and they asked 17,500 adults about their history of these 10 ACEs, and what they found was absolutely striking. 2 things. Number 1, ACEs are incredibly common. 67% of their population had at least 1 adverse childhood experiences, and 12.6% of their population had 4 or more. But the second thing that they found was incredibly striking was that there was a dose-response relationship between these adverse childhood experiences and health outcomes. So a person with an ACE score of 4 or more had a risk of chronic obstructive pulmonary disease that was 2.5 times, 260%, as someone with an ACE score of 0. For heart disease, it was 2.2 times. For stroke, it was 2.4 times. For cancer, it was 1.9 times. For diabetes, it was 1.6 times. Now, the original researchers looked at this and said, whoa, okay, that's pretty scary. And they were trying to figure out, okay, so how does this happen? And initially, we thought it was because, if you're exposed to adversity in childhood, you're more likely to engage in high-risk behavior, and that's what affects your health. And it's true, you are more likely to engage in high-risk behavior. A person with 4 or more ACEs is 7.4 times as likely to be an alcoholic as someone with 0 ACEs, 10.3 times as likely to use injection drugs, and 12.2 times as likely to attempt suicide. But the research shows us that even if you don't engage in any high-risk behavior, even if you don't drink or smoke or do any of those things, you're still at increased risk of all of these health problems. And this has to do with how the impact of adversity gets under our skin, right? When kids are exposed to early adversity, it activates something called your fight or flight response. That's your stress response. And that activates different parts of your body. It activates adrenaline and cortisol. So you have this big hormonal response. And this ultimately affects the way that your brain and body responds to stress. It decreases the activation of your prefrontal cortex, which is the parts that's responsible for memory and learning and executive function. And it increases your parts of your brain, including the amygdala and the parts of the brain that are responsible for fear. And ultimately, what we see is an inhibition in the ability to do executive function and learning. Now, when I saw this data, I was like, holy mackerel. People often ask me about my aha moment. I don't think that the word I said was aha. I was like, wow, this is a really big deal. In fact, when we looked in our patient population at our center, what we found was that, very similar to the Kaiser data, around 2/3, 67% of our patients had at least one adverse childhood experience, and 12% of our patients had 4 or more adverse childhood experiences. The difference is our mean age of our patients was 8 years old. And what we found when we did that research was of our patients, those who had an ACE score of 4 or more were twice as likely to be overweight or obese, and 32 times as likely to have learning or behavior problems as our patients with 0 ACEs. Now, when we think about that in the context of what this means for our society and our population, here in Washington, population data tells us that 62% of Washingtonians have an ACE score of at least 1, and 27% of Washingtonians have an ACE score of 3 or more. And that is why we need organizations like Thrive Washington. Thrive Washington is a model for the nation. When we think about coming up with a public health response for this public health crisis, we know that we need public-private partnerships to ensure that every child in Washington state has an opportunity to succeed in school and in life. This is based on the science of how early adversity affects the brain and body, and we recognize that we need to take a trauma-informed approach to supporting families. We know that an ounce of prevention is worth a pound of cure. And when we look at home visiting, this is actually one of the best interventions that we have seen. Actually, this is one of the interventions that actually has had like these placebo-controlled, randomized control trials demonstrating the efficacy of home visiting as one of the cornerstones in our arsenal for how do we address this public health crisis of early adversity. We also recognize that we need to take a multi-generational approach, right? This is the gold standard. And here at Thrive Washington, one of the things that I have been extremely impressed with is the parent engagement program. One of the things that we're finding is that supporting both parents and children allows caregivers to be able to do the number one most important thing, which is reduce the dose of adversity for the next generation. In order to be able to do that, none of us can do it alone. And we need to support partnerships at all levels, in all sectors. It starts with educating ourselves, our families, and our communities. It starts with making sure that every stakeholder understands how important this is. Whether you're in health, education, child welfare, the dramatic impact on our social outcomes. If you are part of the business community, guess what? The data shows us that your members your employees who have an ACE score of 4 or more are much more likely to take advantage of, to go out on disability. They're much more likely, almost twice as likely, to go out on workers' comp, and they're much more likely to increase the health care costs that you are paying for in your premiums. This is everybody's issue, which is the good news, because it means that we all get to be part of the solution. Our children and our future generations are too important not to make this investment. I think where other folks have seen a huge challenge, we see a profound opportunity. When we look at the scope of this public health crisis, oftentimes people get overwhelmed, right? Okay, how are we going to address this when we're looking at all of these outcomes? But the good news is that we understand early adversity to be the root of the root. And if we figure out how to tackle that, then we see improved outcomes in multiple sectors. In 1983, the mean time from diagnosis to death from HIV/AIDS was 6 months, right? Half of people were dead 6 months after they were diagnosed. 30 years later, the life expectancy on standard antiretroviral therapy is more than 50 years. How did we get there? Number one, we got there from refusing to accept the inevitability of a death sentence. We dove in and said, how the heck does this happen? We need to understand the mechanism, right? Oh my God, it's a virus. Wait, no, it's a retrovirus. Okay, how do we attack this? We're gonna use antiretrovirals. Now, we understand that the earliest years matter. We understand that early adversity has a profound effect on the development not only of the brain, but also on the immune system, hormonal systems, and all of the systems in a child's developing body. And we understand that early detection and effective intervention can interrupt the progression from early adversity to disease and early death. And I promise you that 20 years from now, we will be living in a society where the child who has a high ACE score and goes on to struggle in school or has poor health or social outcomes will be an anomaly. Imagine that future. We can get there. We will break the cycle. Thrive Washington is leading the way, and I just want to extend my heartfelt thanks for all of you in this room who are making that possible. We will make a difference. Thank you.